Hey everybody, it's Felisa. It is a beautiful day in my neighborhood. It is 46 degrees, y'all, in December. This is crazy. I know some of y'all are like, oh girl, let's go. I'm telling you, this is a heat wave where I am. Absolutely beautiful. Y'all know that I'm not against the snowy or the rainy weather, but this is a nice change of pace in December. People are out running errands, getting things done on this final weekend before Christmas, and that's one of the reasons that I'm out today. The other reason I'm out today is picking up a prescription for my daughter, which brings me to this entry into Vlogmas. So this will be a bit of story time, and hopefully this will assist you when you need to navigate healthcare or a health system. So before I start, first of all, this is my story time. So these are things that have happened to me in my experience, but also, I want to be sure to say that these are my ideas, my opinions, my observations, and sometimes my rants. They may or may not work for you. I hope that it does, but in the event that it does not, let's talk about it and see if we can come to some happy medium. Maybe you'll educate me on some things. Here we go. Alrighty, so last year in November, I went to Lagos, Nigeria, for about a week or so in November. At the same time, I sent my daughter, my youngest daughter, to Arizona to be with her best friend and her family over the course of the holiday. While she was gone, she got sick. So she called me. I think I had been in the country probably maybe about 3 days or so. So she calls me. She's like, "Mommy, I'm really sick." Okay, what's going on? So we do a run through of the diagnosis. At the end, she says, "I think that I have strep." She's had strep before. She knows what it feels like. I said, "Okay, get the mom." That's what I call her. Get the mom to take you to urgent care and then call me when you get there. So she says, okay. She goes. I get a call. It's my daughter. She says, "Mommy, do we have state insurance?" It's like, well, yeah, I mean, it's from the state that we're from, but it covers you anywhere. I don't understand what you're asking me. Are they asking me if you have coverage out of the state? She said, "I don't know." Now I can tell that she's really getting frustrated because she don't really want to answer a whole bunch of questions because she's sick. Alrighty, fine. I'm still dealing with a 19-year-old at this point. I'm like, okay, sis, calm down. They've got to ask these questions. It didn't occur to me why they were asking her this question. They weren't asking her what type of insurance or what state we were from. They were asking her if this was Medicaid. So now I'm offended because you have the actual card in your hand with a phone number that you can call, but yet, you're trying to figure out if she has Medicaid. Nowhere on that card does it say Medicaid. I'm not against Medicaid. If you have Medicaid, God bless you, because I've been there, but that's not this. Call the number, sis. Act like you want to do your job. So after I helped her understand that this was a completely ridiculous question because she could have made a phone call to verify the insurance before we even got started with this, the next thing she's saying, well, I need to collect $100 from her to be seen. Okay, fine. I will cash app her, but I just need for her to be seen. I get a call from her after the exam. She's frustrated and fit to be tied because she's like, "Mommy, he gave me ear drops. He said I had an ear infection." Okay, first of all, let me explain again that she's 19. Let me explain again that she was 19 at that time. Let me explain again that she has never had an ear infection in her whole entire life. I breastfed this child, and she has been the healthiest child out of all 4 of my children. I'm very proud of that, by the way. Anyway, she never had an ear infection, so it did not seem logical. I mean, it's possible, plausible. I don't know. It's possible that she could go, out of state and all of a sudden develop an ear infection when she never had one her whole entire life. She wasn't sick to begin with. Okay, whatever. So they give her these ear drops. She takes the ear drops as prescribed. She's still not feeling better. By this time, her throat is on fire and she knows that she has strep. So she makes her way to another urgent care, a CVS Minute Clinic. This nurse is like, "Yeah, I think that the doc was correct. Just keep taking the ear drops, blah, blah, blah." I'm like, are you serious right now? By this time, my daughter is ready to set everything on fire. She's like, "Mom, I asked them to swab my throat and nobody will give me a swab. Like, why won't anybody test me?" I'm like, "I don't know, but this doesn't make any sense." So now I'm trying to help her navigate, in Arizona, and I'm in Africa, like literally. So I'm like, and strep tests don't cost that much. Like, that's not a very expensive test. And it can be done in an office. She could have her results, and if it comes back positive, give her some antibiotics and she can be on her way. Y'all acting like she's asking for an MRI. Like, stop it. So anyway, they collected a $75 copay from us for that. Nothing. So a day or so goes by. Now I'm thinking about, do I need to call Delta and get myself on a flight back home, because nothing that I'm trying is working, and I'm getting frustrated. She's frustrated. She's still sick. Meanwhile, in the middle of all of that, her friend gets sick, so they wind up taking her to the doctor. Her doctor gives her strep. It comes back, strep test. It comes back immediately for strep. My daughter's like, could y'all please test me? Because if she has it, I'm sure I gave it to her. Why won't anybody listen to me? So it was only at that point that they actually got someone to listen and give her a strep test, which came back immediately positive. Immediately. She got her antibiotics. Within 24 hours, she was feeling much better. But my baby had to suffer over a week before anything was done. I was livid, absolutely livid. So I waited until I got back here. Of course, I made a couple of phone calls, to which they said, we can't discuss anything with you because of HIPAA and blah, 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 blah. So I very politely informed them that I wasn't calling to discuss her case specifically. I was calling to tell them that they were derelict and negligent in their assessment and their treatment protocols, that with this clinical presentation, they should have done a strep test for her. Okay, we got past that. But I also began a letter writing campaign, and that is where this vlog comes into play. So there are some tools in your arsenal that you can use when you feel as though you've gotten substandard health care. One of those things is that you can file a grievance with your insurance company. If you are going to see a physician or a specialist or whatever, or eating, it doesn't matter, hospital visit, emergency room visit, whatever, and you feel that you have not gotten the care that you should be getting, you can file a grievance with your insurance company. What happens is that your insurance company will contact the provider. The provider must respond in writing, and they have a certain window of time, and I've forgotten what that is, but I want to say that it's like 30 days that they have to respond to that grievance. They either have one of a few different options. They can admit they messed up and make it right for the member. They can deny that this happened and supply the documentation and the evidence that it didn't happen the way that the member said that it did. Or they can admit that, or they can ask for an extension to investigate. I think that that's the third one. At any rate, they must respond, and the insurance company will get back with you as to what the remedies are and the course of action that you will be able to take moving forward. That's number one. Number two, you can always write the state. If the state of that where your practitioner is practicing or where they have their license. So if you feel that your practitioner was derelict or misdiagnosed or did not, treat you well and cause you to have harm, you can write the state from which the practitioner is licensed and file a grievance at the state level. At that point, the state will investigate that. Every hospital should have either patient satisfaction, service excellence, patient excellence, patient advocacy, some type of department. It may be called something different, so you'll have to explain what it is that you're looking for, because they aren't all called the same thing, unfortunately. So you'll have to ask, when you call, say that you've had a dissatisfying experience and you would like to speak to someone about that, and they will transfer you to whatever department is appropriate. That is the place where you can also file a complaint. And within the policy, because it's internal, every system, every healthcare organization has their own time frame in which they need to work that grievance or work that complaint. Sometimes it's 15 days, sometimes it's 30 days, etc. So what they often will do is take down all of the information, make sure that they have the names and dates and situation correct, and then they will launch an internal investigation and get back to you in terms of what the results are. Now, each hospital system also responds differently. Sometimes there's what we call patient recovery, so to speak, and basically that is an olive branch of the system will offer to you for inconvenience or bad customer service. So I've seen health systems give, gas cards or, gift cards or, offer to provide some type of service at no additional charge, or offer, to do something in terms of scheduling, whatever the case may be, or whatever the situation warrants. There's certainly some flexibility and some leeway within all of the health systems in order to be able to accommodate and to make sure that patients are satisfied and make sure that you're receiving the care that you deserve. At the very least, the one thing that you want to do is make sure that you find a primary care provider that you have a relationship with, that you can call. For me, I have a wonderful relationship, working and professional, with my primary care provider. She's a family medicine doc that I've been going to for years, in addition to my OBGYN. And if I ever have any issue, or if I have any issue with my children, even though my children are way grown, I reach out to her, and she has always made it her business to call me back, put me in the right direction. Even when she doesn't necessarily have that sphere of influence, she certainly will do a warm transfer to someone that does. For instance, when I was having huge issues with my neck right after my accident last year, she made sure that I was seen in orthopedics rather quickly, actually. So, that was a physician to physician kind of connectivity, and I appreciated her for doing that. She didn't have to do that, but she recognized that I was in such tremendous pain, and instead of, having me kind of wait for forever, it was more of a, hey, let's get her in on a consultant kind of basis and see what's happening. And like I said, for that, I'm very grateful. She has, if I've called her because we have a relationship, I feel very comfortable in asking for a referral or recommendation, or she'll talk me through educational kinds of things, basically talking me off the ledge when I have certain things that are going on. So anyway, my whole point that I'm making is that primary care relationship is crucial and it's irreplaceable. If you don't have a good relationship with your primary care provider, then I suggest you shop, just like you shop for anything else. You have someone that's in your corner, that's advocating for you, that's listening to you, that's helping you make educated decisions about your health care, helping you navigate the health system that you're in, because a lot of health systems are super big, and sometimes it's hard to know where you should go or who you should go to for certain services or certain types of care. And so once you have someone in your corner that is advocating for you and helping you to navigate and negotiate all of that kind of thing, it becomes a lot easier, and it reduces anxiety and stress and tension when you don't feel good and you have someone that is advocating for you. A health advocate is exceedingly important. But back to my original statement, which is, don't be afraid to use the tools that you have in terms of lodging a complaint and having your voice heard. There's nothing wrong with that. When you have a physician, physicians should be listening to their patients. They should be providing the best care that they can within their expertise and within their skill set. And if they can't, then they should be referring you elsewhere. If you feel like you don't have a voice, or you feel like you don't matter, or you're not being listened to when you go, then I strongly suggest that you find a physician who will advocate for you. Yep, that's it. Y'all have a wonderful day, and I will talk to y'all later on. Bye.